16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
വാട്ടിയ വാഴയിലയിൽ കുത്തരിച്ചോറും പരിപ്പും പപ്പടവും സാമ്പാറും അവിയലും തോരനുമൊക്കെയായി ഒരു പൊതിച്ചോറ് കിട്ടിയാലോ? കൊതിച്ചു നിൽക്കാതെ വരൂ മോനോ ലൗഞ്ച് ആൻഡ് റെസ്റ്റോറന്റിലേക്ക്. സൗത്ത് ഇന്ത്യൻ, ചൈനീസ്, ഗ്രിൽ തുടങ്ങിയ വ്യത്യസ്ത രുചിഭേദങ്ങൾ നിങ്ങൾക്ക് ആസ്വദിക്കാം ഫാമിലി ഫസ്റ്റ് ക്ലാസ് റെസ്റ്റോറന്റായ മോനോയിൽ നിന്നും. കൂടാതെ പാർട്ടി ഹാൾ, പ്രൈവറ്റ് പാർക്കിംഗ്, ലൈസൻസ്, ഷീഷ, ലൈവ് മ്യൂസിക് എന്നിവയും ലഭ്യമാണ്. മോനോ ലൗഞ്ച് ആൻഡ് റെസ്റ്റോറന്റ് after Siam Garage, Lulu Dana Mall Road, Burhama. Contact number 7793 4111 3363 4111.
Good evening friends, welcome to a new episode of BMC Global Live Hilal Health World, Nothing But Lifestyle. I'm Anupama Menon. In this talk show Health World, we have expert doctors from various fields providing valuable information on different medical topics to assist you all on your journey towards good health. January is the month of cervical cancer awareness. According to WHO, cervical cancer is the fourth most common cancer found amongst women worldwide. In fact, the statistics are alarming. A woman dies of cervical cancer every 2 minutes in the world. There's a lot of stigma and fear attached to cervical cancer, and most of it is due to lack of information and lack of awareness. Cervical cancer is definitely preventable, treatable and curable. In this talk show, Health World, in this episode, we are trying to do our bit by raising awareness about cervical cancer. And to do that, we are happy to have with us Dr. Krishna Kavita Ramavath, internationally acclaimed gynecologist whose area of expertise is gynec oncology. Dr. Krishna Kavita is MD, MRCOG, FCOG, and she comes with a wealth of experience. She has over 40 publications of her research articles on HPV vaccine and cervical cancer awareness. And to top it all, she is also the author of the bestseller book, Smart Life at 40+. Dr. Krishna Kavita is a fellow of the American College of Obstetricians and Gynecologists and also a member of the Royal College of Obstetricians and Gynecologists. She is currently working as Specialist OB/GYN at Al Hilal Hospital, Manama. So let's move over to her and know more about cervical cancer. Dr. Krishna, thank you for joining us and welcome to the show, Doctor.
Thank you very much. I feel really happy to join for the second time.
Yes, happy to have you back.
Same here.
So Doctor, as we mentioned, January is the month of cervical cancer. So for the benefit of the viewers, could you please explain what exactly is cervical cancer and what causes it?
Yes. So as you rightly said, January is a month of cervical cancer awareness, and cervical cancer is the cancer that occurs at the cervix. Cervix is the entrance to the uterus. So abnormal cells which grow uncontrollably in the cervix can cause cervical cancer. The most important causes are 99% it's caused by a virus called HPV. It's a human papilloma virus. And other causes are multiple sexual partners, lack of protective sex, or women with lowered immunity like having HIV, or those women who have who smoke. In them also cervical cancer is seen in increased fold.
Okay, and cervical cancer is often termed as the silent killer, I guess, because a lot of times the symptoms don't show up that easily. So could you please explain what are the symptoms and how is that treated?
So the most common symptoms with which the women come to the doctor's office are, first one is abnormal vaginal bleeding. Women can have a surprise bleeding when they are not expecting their periods. And also some women can come with vaginal odor, which is bad, or the most common symptom is again having a bleeding or spotting after sexual intercourse. In late stages when the cancer is invasive, women can also have kidney failure or urinary obstruction, and they come with weight loss. So these are some signs and symptoms of cervical cancer. And then main thing is that our goal is prevention. We don't want any women to have these kinds of symptoms. We want to prevent it so that no one is left behind. And this is a cancer which we can eliminate.
So Doctor, abnormal vaginal bleeding or bleeding after sexual intercourse, these are the red flags that any woman should look out for, I believe.
Yes, that's correct.
And you also mentioned about HPV. So if you could just elaborate on what exactly it is, how many types of HPVs are there and whether it can be prevented?
Sure. So HPV is a human papilloma virus. This is the most exclusively sexually transmitted virus in sexually active men and women. Most of them carry this HPV virus unknowingly because there are no signs and symptoms. And about 200 types of HPV viruses are seen now, and then each virus has a specific number to it. And there are low risk HPV viruses and also high risk HPV virus. Some viruses which are low risk, they are 6 and 11. These viruses cause warts, plantar warts or hand warts, and they do not turn into cancers. But the other HPV viruses, like a dozen HPV viruses are oncogenic, that is cancer causing potential is there. Among them, 16 and 18 are the
most dangerous ones.
Most dangerous, and then 90% of the cervical cancers are caused by these two viruses.
16 and 18.
16 and 18. So since there are no symptoms and signs, and even body actually eliminates these viruses with the immunity that each woman has. So by about 90% of these HPV viruses are eliminated in 2 years of time by the natural immunity of the body.
So on its own, the body itself has the capacity to eliminate this virus.
Right. And, but some oncogenic viruses, HPV viruses, they persist, and they cause cervical cancer and other genital cancers or oral or throat cancers, which we should keep a close watch on.
So are vaccines available to prevent the dangerous one that you spoke about, 16 and 18?
Yes, yes.
Can vaccination prevent that?
Yes. So HPV is a virus where the vaccination right now, the vaccination is the one which is seriously taken into to eliminate the cervical cancers, and WHO has recommended there are 4 types of US FDA approved vaccines. One is Cervarix, that is which targets 2 of the cervical strains, and then there is Gardasil 4, which is quadrivalent vaccine, which targets the 4 strains of HPV, and recently we have nanovalent Gardasil 9, which targets 9 strains of oncogenic viruses. So vaccination really eliminates, and there are huge number of studies which have been carried out almost in the last 12 years, and then all the studies have said that HPV vaccination can decrease the incidence of cervical cancer by 90%, and the vaccine safety protocol has been very well and meticulously checked, and the vaccine is considered to be very safe in women.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
It's very reassuring to know that, because the general impression is for cancer there is no vaccine. So I guess cervical cancer is the only type of cancer where a vaccine is available which can prevent this from happening.
Only cancer which has a vaccination available, and the CDC and WHO there are guidelines that who should take the vaccine and at what ages the vaccines have to be given. So the guidelines and protocols say that the vaccine should be given at a very early young age, like around 9 to 12 years of age.
Before puberty or after puberty sets in?
Preteens.
Preteens.
Before, actually the idea and rationale behind the vaccination is before the sexual debut. If you give vaccination, body gives a protective immune, it mounts a response, a very good response before the HPV actually enters into the body. So as I said, the sexual activity and prevalence is low at that age. So all women, preteens, boys and girls, it's taken into as a protocol for everybody to screen and then to vaccinate.
So is it given for boys as well?
Yes.
Oh,
it's given as because HPV doesn't just alone cause cervical cancer, it causes penile cancers or it causes anal warts too.
Okay.
So giving a vaccination to the boys, that helps them prevent those diseases, and also unknowingly they might actually transmit the virus to their partners. So helping them with the vaccination prevents those cancers too.
So preteens is the right age for boys and girls to get vaccinated.
Yes. So
and what about after certain age, is it still advisable? Is the efficacy still as much, maybe if somebody takes it when they're in their 40s or 50s?
Yes. So 9 to 26 is a recommended age group. So there are two doses, like if the boys and girls are in between 9 to 15 years, 2 doses of vaccine is really enough, but 6 months apart. But if after 15 years to 26, CDC and FDA recommend 3 doses of vaccine. And for those women and men who are after that age group, like 25 to 45, So they have extended the vaccination to this age group also, but because they have already exposed to HPV virus, vaccine might not be as effective to them. But yet I would recommend vaccination in this age group also, because of the lifestyle changes that women are having. Many things happen in the life during the time. Women also might be having new partners in their life, or with the dating scenarios, they might be meeting new people. So it's always good to protect their cervical health.
Doctor, what about the prevalence of cervical cancer in Bahrain? In your observation, have you seen a lot of cases where women have a cervical cancer, or is it low compared to other parts of the world? Is there any statistics available as well to document cervical cancer cases?
Yes, that's a very good question, Anupama. Actually, there is a Bahrain cancer registry, and the Bahrain, they have looked into the registry, and they say that almost cervical cancer incidence in Bahrain is low. It is 3.5 per 100,000 population, and the cervical cancer deaths in the 2019 are actually 12 deaths documented. There is a HPV, there is a cervical cytology screening as a primary method, but not the HPV test in Bahrain. And when you look at the population of Bahrain, there are almost above 400,000 women and children above 15 years who are eligible or more prone to get cervical cancer. So vaccination is not a national program here. According to the WHO statistics also, annually around 20 to 25% of women are diagnosed, and the death rates are less, around 12. When you look at the HPV overall incidence burden in Bahrain, it is low. It's almost around 27% cases have been with HPV burden.
That's good to know that. So Bahrain, that is better off than maybe a lot of other countries. I guess in US it's quite high.
It is quite high, and it's a 4th ranking cancer among all the women of all the cancers, actually cervical cancer. But in Bahrain, statistics say that it's the 8th most common cancer in women.
So what are the steps taken towards eliminating this? Is there any global strategy that WHO has to prevent this from happening and to create more awareness?
Yes. So World Health Organization has taken this in a very big way. So the World Health Organization, they have targets for all the countries. The numbers are 90, 70, 90. So 90% of the preteen girls, 15 years of age, should be vaccinated by 2030. And then 70% of the women should have a HPV test as a primary screening test at some point in their life at around 35 years of age, at least once, or at the age of 45 years. So 70% should be covered. And 90% of women with pre-invasive cancers, they should be treated, and also 90% of women with invasive cancers, they should be managed. So that's the global strategy which WHO has been given to all the countries, and and we have very less time. Actually, it is just 7 years to achieve this ambitious project. But yes, it can be preventable. And then the only prevention and elimination of cervical cancer is done by 3 methods. One is HPV vaccination, 2 is cervical cancer screening, and the third one is treatment. So in this way, we can eliminate and we can reach the goals that was
by 2030. So that's definitely a ray of hope, I guess. If everybody puts their minds together, I'm sure this can be achieved. With awareness also, I guess more women will be encouraged to go for the screening tests, and like you said, vaccination at a very early age. But vaccination, when we talk about vaccines, are there any risk factors associated with it? How safe is it to get vaccinated?
Very good question. So there is a long safety protocol actually, and they have been trying to check these vaccines for almost 12 years right now, as I have said, and then they have not seen any untoward adverse effects. The most common adverse effects that we see after vaccination is just a soreness in the muscle, so that we just make the person to stay back in the hospital for 15-20 minutes and we observe. Then there are isolated vaccine related illnesses which are not statistically significant, but overall it's a safe.
Very safe to take it. And can you also talk a bit about cervical cancer screening methods? We have often heard about pap smear. That's a very common term that comes to our mind when we talk about HPV, about cervical cancer screening. But I believe these days, even in the doctor's office itself, a lot of tests can be done. So if you could just elaborate on the type of
Yes, screening protocols, right. That's a very good question again. So cervical cancer screening is of two types. One, as commonly everybody know, that's a pap test, and which actually looks at the abnormal cells in the cervix. The second test is the HPV test, which looks at the virus, whether the virus has infected the cervical cells or not. Both tests are done in the doctor's office, and both tests are done in the similar way. But the pap test, it's used for a very long time, and it's very good in detecting the abnormal cells, but it is not very sensitive. Pap test has only sensitivity of 50%. That's why we do pap test every 2 to 3 years to see the abnormal changes. But on the other hand, HPV is a different test. It looks at the virus in the cells, if the virus has affected the cells or not, and if the virus has affected the cells, we can clearly know that this sample is HPV positive.
Okay, so tests need to be done to find out whether HPV is present or not. So pap smear, along with pap smear, an HPV test is equally important to find out the prevalence of the virus.
So the age groups like from 21 to 29 years, women can go for a pap smear every 3 years. But from 30 years to 64 years, HPV, at least they have to get it done every 5 years. The reason is every 5 years because HPV test is more accurate in diagnosing. And when the women comes with a result saying that it is HPV positive, it doesn't mean that women have cervical cancer, or it doesn't even mean that you're going to get a cancer. It only means that high risk HPV strain is present in the sample and we need to closely monitor. That's how the doctor discusses what has to be done with a positive test result.
So has HPV vaccine changed the screening and the treatment of cervical cancer in any way? Because maybe once the vaccine has been taken, do you think it's still important for women to go for regular checkups?
Yes, definitely. So vaccination has not changed any screening protocols as such. The aim of vaccination is to target two strains, 16 and 18 mainly, the oncogenic strain, but there are hundreds of other strains. So women can have HPV or repeated infection with HPV with other strains. So all the women who have vaccinated or their children who have vaccinated should go for regular screenings. Screenings are the time where we detect the precancerous or pre-invasive lesions, where we can treat the lesions at the same time, so that the cervical cancer has a very lengthy time span of around 15 to 20 years to get into proper cancer. So we have time to treat the pre-invasive lesions.
Okay, and what about the precancerous lesions?
Yes, so actually when the woman comes to the doctor's office, we do check her cervix and send the cells for to the lab to check if the HPV viral infection is there. If the HPV is positive, automatically they check for the cytology and see the cellular changes. If the cells are abnormal, the report comes as abnormal cells are present in this, and then we do treat these women in a different way. Like we monitor these women very closely, and the next step of any HPV positive test result is to go for a colposcopy. Colposcopy is where we check closely the cervix, and then we take colposcopic guided biopsies to see what depth of cervix is involved. If it is less than 1/3 involvement of the abnormal cells or with the virus, then we call CIN1. CIN is cervical intraepithelial neoplasia. We grade it 1, 2, 3 depending upon the infection that has been upscaling. So if 2/3 of cervix is involved, then we say CIN2. If whole of the cervix is involved, we say that it is CIN3, but it is not an invasive cancer. So these are pre-invasive lesions where we can treat them with ablative therapies or excisional therapies. And we do have ablative therapies and excisional therapies at Al Hilal. So at Al Hilal, we have treated a lot of pre-invasive lesions, and women have been recovered very well too.
Doctor, what does ending of cervical cancer exactly mean?
So that's really a very good question. So we have all the tools to eliminate cervical cancer. We have vaccinations, we have screenings, and we have treatment methods. All this requires is awareness. Women should be aware, having a kind of awareness that they should come to the doctor's offices and get checked up. So knowledge is power, and I really believe that. So at Al Hilal, we are actively treating women, and we are doing HPV DNA as a primary cervical cancer screening methods, and we are also treating pre-invasive cancers. So women should take the advantage of this and definitely come to the offices for gynecological checkups.
So I hope this serves as a wake-up call to all the lovely ladies out there. You know, they have to make their health a priority. Regular screenings, getting vaccinated, these are all very, very important. And I guess awareness plays a very key role in prevention of cervical cancer. So what is the way forward? Does the future look bright? Can we envision a world free of cervical cancer by 2030?
Even though it looks ambitious, it is definitely made possible again with the awareness and doing the right things at the right time. And so do not hesitate to come and meet your gynecologist, and we are always available. And I am Dr. Krishna Ramavath. You will see me at Manama Al Hilal branch, and my timings are 1 to 9 p.m. Thank you very much, and at any time you can call me.
Thank you so much, doctor, for joining us on the show today and for explaining to us in detail about cervical cancer. Appreciate you taking the time out to be with us, and thank you for your patience as well. Friends, I'm sure all of you found this talk by Dr. Krishna Kavita very informative and useful. So as doctor rightly mentioned, please don't take your health lightly. Make your health a priority. Cancer is a disease. It's not a death sentence. There is a life beyond cancer. Together, we can beat cancer with a positive attitude, with a strong mind and timely medical intervention. Your life is in your hands. Please do go for screenings and make sure that you are vaccinated and your daughters are also vaccinated. Wishing you all lots of happiness and good health always. Till we meet again next time, this is Anupama signing off. Good night and stay safe.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahala. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.